I've been lucky enough to use the IBD Registry for the last few years. There are elements that have clearly improved the way that we can provide the service for our patients.
So if I go to my hospital, all they have to do is a click of a button, all my information would be there with regards to my case and my health. For that information to be there would help me greatly, as it would with other patients. And it's such a simple idea.
Moving to a system of capturing electronically critically relevant patient data at the point of contact enables a whole range of outcomes. These include benchmarking performance against national standards, an infrastructure to take forward the excellent work already done by the IBD audit team, and also opportunities to contribute to pharmacovigilance, clinical research and commissioning. You will find it quicker to access the patient details. Maybe if they telephone you from off-site when you don't have their notes, you'll find it much easier to remember key aspects of their condition, to measure what you're doing against benchmark statements or audit, give them a copy of the GP letter as they leave the room. It will be useful not just for you, but for patients, and obviously also for managers and commissioners.
Knowledge is power, that comes from data, and if we can do more to get services across the whole of the UK working in that way, then that benefits everyone. It benefits clinicians, and most importantly, it benefits patients.
The way that we use data, we record it when we see our patients, we write it down on a bit of paper, and essentially that data is useless. So what about a different way of recording how we see our patients? What about using a patient management system where we're recording data in a structured way, we're using proper disease activity scoring systems, we're thinking about what the problems are for our patients?
If you collect the data, then some value will come back. Teams can then start the development of useful measures that will actually inform maybe day-to-day decision making, but certainly the planning and the commissioning of their local services.
The registry offers a potential focal point to bring together the data needs of a variety of stakeholders, whether that be for direct care delivery, for audit, for research.
Once the data leaves the hospital to come to the IBD registry, it's important that we safeguard your identity and make sure it's properly protected. Now, we do that by working with the Health and Social Care Information Centre, and they then extract some of the data to make sure that it's what we call pseudonymised, so made nearly anonymous before it's sent to the IBD registry. I should add, though, that if as a patient you decide that you don't want your data to be used, you do have the right to refuse your consent, and that won't affect your treatment in any way whatsoever.
One of the key outcomes of the IBD registry is to support research on a national level in the UK, but also at a local level.
The more data we can have for medical research, the more benefit it's going to be for all IBD patients.
Because we think that's where the real power of the registry comes. Once you do have really quite small amounts of information registered, but most of your locally treated patients in the system.
And I think we therefore have a fantastic opportunity to really revolutionise the way we collect and use data that should have the specific deliverable of being for the benefit of the people who use the services that we run.
Our wish for the future would be to ensure 100% take-up, ensuring that patients get the best level of treatment and care wherever they may sit in the United Kingdom is absolutely critical, and we will only achieve that with all of the trusts across the United Kingdom picking up and running with the work of the registry.
A registry is music basically to my ears, because it's something really we're crying out for and should be happening now.